quality, affordable health care is the right of every child, woman, and man in our country, not a privilege just for those fortunate enough to have it. We passed H.R. 987, as you probably know.
I do.
The Strengthening Healthcare and Lowering Prescription Drugs Costs Act. And it's a bill that I think really is a very important one for people in the situation that your son and so many people around the country are in. It would lower prescription drug prices, and it would also make sure that people like Brandon are not sold junk insurance plans, which are plans that people spend money on and then end up not getting any kind of worthwhile coverage from them. We, of course, also passed H.R. 986, which is the Protecting Americans with Pre-Existing Conditions Act, and it included an amendment that I offered, which got wide bipartisan support. 78 Republicans voted for it. And that amendment was specifically aimed at making sure that premiums could not be raised on people with pre-existing conditions.
Brandon was diagnosed with type 1 diabetes 11 years ago. He was 11 years old.
And 22 now.
Yes, he is. And it's been a struggle to manage, and there are good days and bad days. The big struggle being sometimes the cost.
Mm-hmm. And the statistics I've heard is the insulin prices have risen more than 500% over the last 14 years.
Absolutely, they have.
You've seen constant increases in the price?
Oh, yes.
Okay.
We're talking about over $1,000 a month for insulin. And insulin he needs to stay alive.
Mm-hmm.
This isn't a choice. This is a necessity. Without the insulin, my son would die. What's beginning to happen with other young, early 20-year-olds is they have to ration their insulin because they can't afford it. So people are dying because of this.
Well, so I was just going to ask you, and we've all heard these stories of people who ration their medications, insulin and otherwise, because of cost. And I know that you're an advocate for people with diabetes, so you probably have had some conversations with medical professionals. What do you understand would be the effect if Brandon were to ration his insulin?
In rationing insulin, his blood sugar numbers would go up. As those blood sugar numbers go up and stay up, it presents so many health risks.
Mm-hmm.
He would develop fluid in his eye and could go blind. Neuropathy, he could lose a foot, feet, hands. It does damage to your vital organs, your kidney, your liver. Eventually, they will shut down and you will die. Insulin for Brandon is a life-saving drug.
I'd like to ask you if there are things specifically that you want me and other members of Congress to be focused on to help people who are in the kind of situation that Brandon is in.
Yes. Please look into the cost of insulin. There has to be something that can be done. The insulin price is going higher and higher. There has been no change to the formula. It is the same formula now that it was 11 years ago. Why the pricing?
So it's not new and improved. It's just more expensive.
Exactly. This is not a drug. It's not a disease my son chose. This is the drug that saves his life 24/7, 365 days a year.
Mm-hmm.
The price is out of reach for too many people.